Good morning. Thank you for coming today. Before we begin, I would like to explain that today's assessment is intended to evaluate your vocational abilities and determine your current work capacity. If you do not understand a question, please let me know and I will repeat or clarify it. Are you comfortable to begin? Please tell me your full name. Could you spell your last name for me? What is your date of birth? How old are you? What is your current home address? Are you currently married, single, divorced, or widowed? Who lives with you at home? Do you have any children? What is the highest level of education that you completed? Did you receive any vocational training, college education, or university education? Have you completed any professional certifications or trade licenses? What languages do you speak? Which language are you most comfortable speaking at work? Can you read and write English? Do you use a computer regularly? How would you rate your computer skills? Can you use Microsoft Word? Can you use Microsoft Excel? Can you send and receive emails? Can you search for information on the internet? Let's talk about your employment history. What was your most recent job? Who was your employer? How long did you work for that company? Was it a full-time or part-time position? How many hours did you work each week? Did you work daytime shifts, evening shifts, or rotating shifts? What were your main job duties? Please describe a typical workday from the moment you arrived at work until the end of your shift. How much time did you spend standing? How much time did you spend walking? How much time did you spend sitting? Did your job require frequent bending? Did you have to squat or kneel? Did you have to climb ladders? Did you push or pull heavy equipment? How often did you lift objects during a normal workday? What was the average weight that you lifted? What was the heaviest object you ever lifted? Did anyone help you lift heavy items? Did you operate any machinery? Did you use a forklift? Were you responsible for inventory? Did you supervise other employees? Did you complete paperwork as part of your job? Did you receive any special training from your employer? What did you enjoy most about your previous job? What was the most physically demanding part of your work? What was the most stressful part of your work? Before this job, what other jobs did you have? How long did you work in each of those positions? Why did you leave those jobs? Looking back over your entire career, which job do you think best matched your skills? Is there anything else you would like to tell me about your work history before we move on? Now I'd like to talk about your injury. Can you tell me exactly what happened on the day of your injury? What date did the injury occur? Where were you working at the time? What were you doing immediately before the injury happened? Can you describe the task you were performing? How much did the object weigh? Did you feel pain immediately, or did it develop later? Where did you first notice the pain? Did you hear or feel a pop or a snap? Were you able to continue working after the injury? Did you report the injury to your supervisor right away? Did anyone witness the incident? Did you complete an incident report? Did your employer send you for medical treatment? Did you go to the emergency department? Did you see your family doctor? How soon after the injury did you see a doctor? What diagnosis were you given? Have you seen any specialists? Have you seen an orthopedic surgeon? Have you seen a neurologist? Have you seen a pain specialist? Have you had any x-rays? Have you had an MRI? Have you had a CT scan? What did the imaging results show? Have you had surgery? If not, has surgery ever been recommended? Are you currently waiting for surgery? Have you received physiotherapy? How many physiotherapy sessions have you attended? Did physiotherapy help your symptoms? Have you received chiropractic treatment? Have you received massage therapy? Have you tried acupuncture? Have you participated in a work conditioning or rehabilitation program? What medications are you currently taking? How often do you take your medication? Do the medications help relieve your pain? Do you experience any side effects from your medications? Have you received any injections for pain management? Have you ever been hospitalized because of this injury? Have your symptoms improved since the injury? Have your symptoms stayed the same? Have your symptoms become worse? Please point to the area where you feel the most pain. Does the pain stay in one place, or does it travel down your arm or leg? Do you experience numbness? Do you experience tingling? Do you experience weakness? Do you have difficulty sleeping because of the pain? How many hours do you sleep each night? Do you wake up because of the pain? How would you describe your pain? Is it sharp? Is it dull? Is it burning? Is it aching? Is it stabbing? Is it constant? Or does it come and go? On a scale from 0 to 10, What is your pain level right now? What is your pain level on your best day? What is your pain level on your worst day? What activities increase your pain? Does sitting increase your pain? Does standing increase your pain? Does walking increase your pain? Does bending increase your pain? Does lifting increase your pain? What makes your pain better? Does resting help? Does changing positions help? Does lying down help? Does heat help? Does ice help? Do pain medications help? Do you believe your condition is improving? What concerns do you have about your recovery? What are your doctor's current recommendations? Have you been given any work restrictions? Has your doctor told you not to lift heavy objects? Has your doctor advised you to avoid prolonged standing? Has your doctor advised you to avoid prolonged sitting? Do you think you could return to your previous job today if you had the opportunity? Why or why not? What do you think is your biggest limitation right now? Is there anything else about your injury or medical condition that you think I should know? Now I'd like to ask you some questions about your daily activities. Please describe a typical day for me, starting from the time you wake up until you go to bed. What time do you usually wake up? Do you need help getting out of bed? Are you able to get dressed by yourself? Do you have any difficulty putting on your socks or shoes? Can you take a shower without assistance? Do you have difficulty washing your hair or your back? Can you brush your teeth without pain? Can you prepare your own breakfast? Do you cook your own meals? How often do you cook? Can you stand long enough to prepare a complete meal? Do you wash the dishes after cooking? Can you clean your kitchen? Can you vacuum your home? Can you sweep or mop the floor? Can you dust furniture? Can you clean the bathroom? Can you make your bed? Can you change the bed sheets? Can you carry a laundry basket? Can you wash and fold your clothes? Can you iron your clothes? Can you carry groceries from your car into your house? Approximately how much weight can you comfortably carry? Can you reach items on a high shelf? Can you bend down to pick something up from the floor? Can you kneel? Can you squat? Can you crawl if necessary? Can you climb stairs without holding the handrail? How many flights of stairs can you climb before you need to stop? Can you walk around a shopping mall? How long can you walk before you need to rest? Can you stand in line at a grocery store? How long can you stand comfortably? How long can you sit comfortably? Do you need to change positions frequently? How often do you need to stand up while sitting? Can you drive? How often do you drive? How long can you drive before your symptoms become worse? Do you use public transportation? Can you get on and off a bus without assistance? Can you carry a backpack or shopping bag while walking? Do you go grocery shopping by yourself? Who usually does the grocery shopping? Who does the household cleaning? Who does the yard work? Who takes out the garbage? Can you cut the grass? Can you shovel snow? Can you rake leaves? Do you have any hobbies? Are you still able to enjoy your hobbies? Do you exercise regularly? What type of exercise do you do? How often do you exercise? Can you attend social gatherings? Do you visit friends or relatives? How often do you leave your home? Do you spend most of your day sitting, standing, or lying down? Do you need to take naps during the day? How many hours do you sleep at night? Do you wake up because of pain? Do you feel rested in the morning? How has your injury changed your daily routine? What activities can you no longer do because of your injury? What activities are difficult but still possible? What activities can you perform without any difficulty? Do you require help from family members? How often do they help you? Do you use any assistive devices? Do you use a cane? Do you use a walker? Do you wear a back brace? Do you use any special equipment at home? Have you experienced any falls during the past year? Do you feel safe walking outdoors? Do you avoid certain activities because you are afraid of making your condition worse? What is the most difficult task you perform each day? What is the easiest task for you? Overall, how independent do you consider yourself in your daily activities? Is there anything else about your daily life that you think I should know?